welcome back to All Business Media TV, where it's all business, all the time. Here's your host, Rick Delgado.
And welcome to All Business Media TV. I'm your host, Rick Delgado, and joining us today on the show all the way from Casper, Wyoming, is Daane Froehlich. Sarah, welcome to the show, and how are you today?
I'm fine, Rick. Thank you.
All right. Well, thank you for making your way to our studios here. Sarah is the owner at 10 Mile Holistic Veterinary Care out of Casper, Wyoming. She's known as Dr. Sarah. So if you call there at 307-277-4109, ask for Dr. Sarah, and she'll be able to take care of you. The website, drsarahholisticvet.com. That's drsarahholisticvet.com. Or, like I said, the phone number, 307-277-4109. And again, Sarah, we appreciate you joining us today. Hey, tell us a little bit about yourself and exactly what you guys do over at 10 Mile Holistic Care.
Well, I became a veterinarian over 30 years ago.
Mm-hmm.
And at that time, I practiced regular medicine, just the Western medicine.
Right.
I heard a lecture on acupuncture, and I was intrigued. That was when I was in vet school, and thought, I'd like to learn that someday.
Right.
Well, someday took me till about 1998. And I sort of went down the path of just holistic medicine gradually, right, and have been doing just holistic medicine for about 10 years.
Oh, okay. So you started out as the regular vet.
Yes.
The one that everybody would go to, and they bring their animals in, and the animals get nervous because here comes the doctor, and that kind of thing. And how long were you just doing, I would say, regular Western medicine veterinary?
Probably about 12 years.
12 years.
And then there was a period in there where I was gradually adding in the holistic medicine as I learned. I started with acupuncture,
right,
added in chiropractic, herbs. I just kept adding things in, and then I decided that was really all I wanted to do.
Right. Now, this to me is interesting. I know we've talked before on the radio, and trying to wrap my mind around doing chiropractic on an animal, because you do that as well, right?
Yes.
Explain how that works, because I think I mentioned I've got a dog. He doesn't like to sit around too much, and when he does, he wants to sleep. You don't want anybody touching him. How do you go about working in chiropractic? Because I've been to chiropractors throughout the last 20 years, and I know sometimes it can be it can be a little jarring. There's a little force involved, stuff like that. How do you do that to a pet and a smaller animal like that?
Well, first of all, we're going to watch them move to see where we see problems within the body and how they're moving, because where you see a limp may not be the only place there's issues going on, and we need to cover head to tail in order to make sure everything's working properly.
Right.
And then you don't adjust anything without having motion to the joint first. You need to know whether the joint is stuck or not.
Okay.
And which way it's stuck, so you know which way to apply a gentle force. And then you just hold the bone on one joint has to be still, and you apply force on the next bone in the direction that joint moves,
right,
in order to loosen things up.
Okay. Now
it's very gentle. Usually they don't mind it.
Okay.
Occasionally you'll have a spot that's sore, but I do often do soft tissue techniques beforehand, or maybe acupuncture. It depends upon what I might do in order to relax things.
Right. Now, when you mean soft tissue techniques, what does that entail?
It can be massage. I also do craniosacral work.
All on pets?
Yeah.
Oh, that's amazing.
If you get the soft tissue relaxed, then the joint restriction will release much more easily,
right, and
it's easier on the animal. If you do it and it's painful, occasionally they can turn around and go, ouch.
Right. Now, when you're doing, let's stay with the chiropractic. What kind of animals can you do that on?
Anything that has a spine.
Really? So you've done it on like dogs and cats and stuff like that?
Mostly I've just done dogs, cats, horses. I had a rabbit brought into me once.
Really?
Yeah. I had to go back and look at the anatomy to figure out what their anatomy was as far as vertebra and number of ribs and exactly what was located where.
Really?
Yeah.
See, to me, that's, how would someone even know that, you know what, my pet needs a chiropractor? I mean, how do you even get to that point where, okay, you know what, here, my dog or cat or turtle or whatever they have, and they bring that to you, how do you even know at that point? Like I said, you make that determination, I guess.
Well, a lot of times people will they've had chiropractic for themselves.
Right.
They might look at their dog or their cat and say, oh, it's not moving right, chiropractic would help me, I think.
Right.
Or they see an arched back, and they know the dog's walking in a way that's painful. Or the horse that isn't moving right, a lot of times they'll think it might be a chiropractic issue.
Right.
Sometimes it is, sometimes it's not. Sometimes I end up saying, no, I think acupuncture or something else might help.
Right. Now, is that something where even before you get started, say doing some chiropractic on an animal, you might say, let's do an x-ray to make sure that there's nothing broken?
I actually don't have an x-ray machine in my office. Okay. I just do holistic work.
Right.
So if someone's bringing in an animal and they have x-rays, I can look at those.
Oh, okay.
If there's something where there's been some type of orthopedic surgery done, anything that's an unusual abnormality that I need to know about, it might affect the joints and how I would adjust, then I'm going to want to see x-rays, and I'll just have them send them or bring them.
Right. And again, you come from the old school, I guess, the old way of doing veterinary care.
Yeah.
Of doing the Western stuff where most people, I would say, that's what they're familiar with. And then the holistic side, you've added throughout the years, but you can still reach back into your toolbox, so to speak.
Yes.
Into the other ways to get to the root of the problem.
Right. If I think that there's something that actually needs the Western style medicine, I will let people know.
Right.
And many of them are mixing the two together. So they're getting treatment in the Western style, but they want to add in something else for support.
Now what drew you to that? Because again, you got started, I'm sure when you were a kid growing up, I want to be a vet, and you hear that a lot from kids. They want to be a doctor or a nurse, or they want to be a fireman or police. Vet is a big one, I know.
Yeah.
I know. When you went down that path and all of a sudden you kind of got exposed to this other way of doing it, like what drew you in away from, I guess, just being a regular vet?
The fact that I could help cases that I had not been able to help before, that I maybe didn't know what to do with. I knew there was a problem and something comes in and it's limping, I can't find an issue.
Right.
Here, take some anti-inflammatories.
Right.
Take the 2 aspirin and call me in the morning type thing. And sometimes they'd get better and sometimes they didn't.
Right.
So it's being able to help those cases you don't normally help.
Right.
I had a cat named Pee-wee brought into me a number of years ago. And
was he like 800 pounds, like just a huge cat named Pee-wee?
No, he was a little tiny cat named Pee-wee. The name fit him.
Right, okay.
And the gal had him since he was a kitten. And as soon as he was put on food off of his mother's milk, he started having problems and he was vomiting.
Okay.
Initially, he was vomiting 4 and 5 times a day. And working with a regular veterinarian, she'd gotten that down to about 4 or 5 times a week. But he was still smaller than normal and he didn't have a good hair coat.
Right.
And she's like, I think I'd like to go try the holistic approach. Her vet said, yes. I don't know what else to do.
Right.
And I did acupuncture, and I did some herbs and some homeopathy. And over time, we have the cat doing great. He's sleek and shiny in his coat. He put the weight on that he needed to finish filling out and growing.
Right.
He came in, he was about 18 months when I saw him. And about a year, it took about a year before he was really doing well.
Right. And usually at 18 months, cats are pretty good size by then, right?
Yeah, they'd normally be full size. So he was actually able to catch up. So.
Wow. Okay. So that's one of those little feathers in your cap you get to kind of shine the light on exactly how you're able to help where regular medicine wasn't able to do it.
They've been able to help so far, and then I was able to find something that gave the rest of the boost that he needed.
Right. Exactly. And again, it's stuff like this that a lot of people don't really know about, so it's nice to have us discussing it because you can kind of shine a light on some of the other, I guess, options there are out there, especially like you said, the regular medicine can only take that cat so far. And it's like, what do we need to do to get this cat basically normal? Yeah. So it's nice to be able to kind of, provide those answers for the pet owners, because I know I'm a pet owner, Sarah. I've told you, and they're not an animal to me.
No, they're family members.
Right.
Yeah.
Exactly. So you want to do as much as you can, to make sure that they're as healthy as possible. Now, talk to me about the acupuncture, because I think I've had just about everything done. I've had the chiropractic, I've had this and that, and I've had acupuncture. And I know that that's, you know, and when you see it, it's kind of like, okay, you know, you lay still, they put in all these needles, and you have to lay there, right? Mm-hmm. But how do you do that with an animal? Because an animal, they don't want to sit still, especially if they know that somebody's sticking something in them. They're always like looking, they want to lick it, they want to do everything to it, right?
Yeah, well, they're not going to lay still most of the time. Some of them do. Uh-huh. They don't seem to mind the needles.
No?
They don't have, I'm needle phobic, which is kind of odd. I'm a doctor and I do acupuncture. But they don't have any preconceived notions for the most part. And the acupuncture needles are very, very fine.
Right.
So it's not like sticking in a hypodermic needle. Many times there's an initial prick and then it slides in without much pain.
Right.
So they don't usually seem to care as much. Also, they can move around and it doesn't seem to bother them. You put acupuncture needles in me and it's gone into a muscle, I don't want to move that muscle. I'm going to lay still.
Right.
But it doesn't seem to bother them to move.
So in other words, you could be doing acupuncture to, say, a cat who decides, you know what, see you later, Dr. Sarah, I'm going to start walking around your office here.
Cats I usually keep still, and they're
Okay.
pretty easy to keep still. And I'm usually not putting many needles in them. The dogs sometimes are up or down or moving, and a horse is going to be moving around after you put the needles in as well.
But I mean, in terms of them moving around, is that an issue with you trying to, because I just have this picture in my head now, Dr. Sarah chasing around an animal, like, wait, I got to get another one in.
Oh,
here.
like a flying needle technique where you're throwing the needles at them?
It's almost like throwing darts. It's like, what?
No, because usually they're fairly relaxed by the time I get to doing the acupuncture.
Okay.
And I can just slip the needles in. I'm also not usually using many needles. When you first start doing acupuncture, you're often using a lot of needles.
Right.
And then as you get used to it and you figure out how you want to utilize the acupuncture and you're more familiar with being able to pick good points,
Right.
you use fewer and fewer needles.
So that just, as far as that's concerned, it's more experience because as you decide, okay, you know what, I think I know what ails this particular, you know, we'll call them the patient. You'll know I'm just going to focus over on this area as opposed to using, like you said, all the other needles that maybe someone less experienced would end up using.
Right, and a lot of times you're looking at maybe a root cause.
Right.
You might be taking the pulse from a Chinese medicine standpoint and going, which meridian is out of balance? What do I need to balance here?
Right.
And you're going more for that and less for everything under the sun to treat all the different areas that may be painful or sore.
Right. Now when you say meridians, can you explain that a little bit? Because I don't know what the heck you're talking about.
In Chinese medicine, they look at qi, or the flow of energy flowing through the body.
Okay.
And it enters into the lung meridian. And it flows through the lung meridian into the large intestine meridian. And these meridians can be tracked as lines on the body.
Okay.
Many times they do parallel where nerve tracks go. And the energy is just seen to go from one pathway to the next. It spends 2 hours in each of the meridians. There's 12 meridians.
Okay.
So it's 2 hours in each meridian.
So now is that for humans or for any living animal?
Any living animal.
Okay.
Now the Chinese charts in acupuncture, there's charts with all the meridians for people. They also created charts for cattle, pigs, horses, and chickens, which were their important farm animals.
Right.
And those, they actually weren't using meridians, they just used specific points that were named on the body.
Right.
When we're learning it, we're learning the meridians transposed to the animals, and then you have to adjust it because we've got 5 fingers, but a horse is walking on 1 toe.
Right.
So then there's a modification for where the points are.
All right. So when you're dealing with, say, okay, so you bring up a horse. Now that's got to be difficult, simply because you're talking the size and the scope of the horse, and the size of the animal is pretty large, and you're trying to work those meridians, right?
Yeah.
In that animal. How do you go about determining which ones you need to address? Because okay, the horse might have a limp, so to speak, But again, you're dealing with the root cause, right? You might something that's unrelated to that leg being the one that's limping on could be the problem, right?
It could be. There's a lot of different ways to pick acupuncture points. There's, like I said, I will often use the pulse as a way to determine it. There's the 8 principle, which is, if you've heard the terms yin and yang.
Yep.
And so that's looking at yin and yang and a variety of different things in the body that way. And there's a way to get a diagnosis that way. There's a way to get a diagnosis off the pulse with 5 elements. You can.
Elements.
That's another system in Chinese medicine.
Now I'm all confused.
Right.
Now I'm thinking of Mila Jovovich.
There's no way I can say there's one way to find your treatment points. There's multiple ways.
Right.
And each practitioner is going to do something different, and we're going to suit it to the animal at that time.
Right.
So we may be looking for something specific to that area, or we might have realized that it's coming from someplace else. We might do points in the area locally to help that spot, and we might do something elsewhere in the body to balance the pulse out.
Right. Now, when you're using, I guess you use the pulse method because you mentioned
it's
that.
one of the things I use,
Okay.
yeah.
How do you go about determining, okay, so you're getting the pulse of the animal, is that what I'm understanding?
Yeah.
And how do you determine from their pulse where you think the issue could be?
Well, for me, I'm looking at which meridian may be weak or strong.
Okay.
In a group.
Are there different pulse points on the animal that you check?
Yeah.
So it's not just one, it's not like,
well, in a human, you can check
you go here.
Yeah.
You probably go here, right?
You can use the jugular vein in a horse. You can use the arteries in the hind legs in a dog.
Okay.
Or you can do a surrogate type pulse where you're checking on yourself and you're touching the animal.
Right. Now, when you're checking different points of the animal, do you get different indications from that pulse point?
Well,
like a pulse might be a little bit off on the leg, say, of a dog, but when you check the other area, it seems fine. So then you know that, okay, it seems like it's coming from over here, kind of thing.
Well, the pulse can either go which meridian is strong or weak, or you can do. Is it a thin, ropey pulse? Is it a deep pulse? Is it a superficial pulse? That goes with that 8 principle, where I talked about the yin and yang. So like I said, there's so many different ways this can be done, and it's kind of confusing.
Right.
It's just that there's a lot of ways to do it and go in and find what helps.
Right.
I've used acupuncture points for horses with painful feet, which is a condition in them called laminitis. There's no equivalent to it in humans. And they get very, very sore front feet. Sometimes they don't even want to walk. And you can take acupuncture, and as soon as you put the needles in, the pulse that you're feeling that's pounding in their leg down above their hoof is suddenly almost normal, and they're comfortable enough to get up and walk around.
Right. Wow.
Yeah.
That's pretty cool. That's got to be a bit of relief for, say people that own horses out where you are, to know that hey, you know what? I can't figure this out. My regular vet can't figure it out. But guess what? Dr. Sarah can figure it out.
Well, laminitis, usually they know, and I don't see as many of those because it's very, very painful. But I've treated a number of them and been able to help them be more comfortable, and then you can go in with other things to work on the root cause. But that can get them comfortable enough at that point that they can at least stand up and move and get to food and water.
Right. Which is, let's face it, it's important because the body's going to heal itself once it gets the proper nutrition.
And that's what holistic healing is all about, is providing the right tools and things that the body needs so it can heal itself.
Right. Now speaking of nutrition, because do you do a lot of that with your patients that come in? And I should say the patients' owners or parents.
The pet parents?
Yes, the pet parents.
Yeah, I'll do a lot of that. More of it is with the small animals, the dogs and the cats, than with the horses.
Right.
So we will be looking at what they're feeding, and is that maybe contributing to the problem? If we switch it, is it going to help them heal faster?
Right. Now what about in terms of, say, because you hear a lot recently, I think, has been made of, I feed my pet raw. And it's like, okay, well, what is that? How do you actually do that? Does it mean you just take a hunk of meat out of the freezer and throw it down on the plate? I mean, explain the whole raw diet versus, I guess, a more natural diet for a pet.
Well, one of the common things that's fed is the dry food.
Okay.
And that's convenient.
Yeah.
But it is not that nutritious. It's like if we took all of our food for the day, processed it, cooked it to high temperatures, all mixed together, extruded it out in a pellet and said, here, eat that, it's nutritious. It's got everything in there that you need.
Right.
We would go, okay, really, that's not the same thing as eating the fresh meat and the fresh vegetables and the fresh fruit.
Right.
So going away from the dry food, you can move to canned food. That's got more moisture in it, but it's still been highly cooked.
Right.
And dogs and cats really evolved to eat prey. So they're not cooking their food.
Yeah.
So ideally, that's where looking at coming into raw food, it's more natural. They have the enzymes in there. They haven't been destroyed by cooking.
Right.
And it provides, really, the fresh food provides a better way to go. You can also do lightly cooked food. And you can find all of these sold commercially, or you can make it on your own. The difficulty with making something on your own is making sure you've balanced it and have all the vitamins and minerals and everything that they need in the appropriate levels.
Right.
So that's harder. That's why it's easier to buy something.
Right. Now, in terms of if somebody's going down that road, is it stuff like carrots and peas you can add to that food and stuff to kind of help give it that balance? I'm just trying to think of how it might be prepared, because, you know, for anybody who's interested in doing that, you know, or if they're thinking about getting a pet, be like, look, I want to, you know, try and make it as healthy as possible, you know, food-wise, because you always hear these horror stories of, okay, don't get your food from this, or, you know, China, you don't want food from China because that's, you know, made with a bunch of bad stuff. How would you go about balancing that?
There's a lot of information out there. Some of it's good, some of it's not. Dr. Karen Becker has a lot of good information on her website on what to do in balancing food. And it's not simply, I'm going to throw in some vegetables and some raw meat and some of this and some of that. They need a certain amount of organ meats, like some heart, maybe some liver, as well as the muscle meat. And then you're looking at balancing things like copper and iodine and manganese. Manganese, a good source for that's actually out of hair. Well, we're not feeding hair. We're not going to go out and clip hair and throw it in there.
No, definitely
you know.
not.
But when you think about it, if they catch a rabbit, they're eating the whole thing.
That's
and
true.
there's actually nutrition out of that hair. So really, if you want to make a homemade diet, you really need to contact a holistic veterinarian and find out do some research, and don't just go grabbing the first thing, because it may not be balanced, and then that can cause problems as well.
All right, well, that's good to know. I guess maybe I'll let my dog out and let him catch those squirrels. Like, here's a little extra for you, go at it. Again, we're talking to our guest, Dr. Sarah. She is the owner at Holistic 10 Mile Holistic Veterinary Care out of Casper, Wyoming. DrSarahHolisticVet.com is her website. 307-277-4109 is her phone number. You can reach out to her, especially if you're in the Casper, Wyoming area. She does do a lot of work with, you know, animals of any size, right?
Yes.
Now, what's the range? I know dogs and cats, that's normal. You mentioned horses. What are some of the other examples of animals that you've treated?
Well, if you go back to when I was doing regular veterinary work, I've done from parakeet, gerbils, hamsters, rats, up to bison.
Really?
Yeah.
All right, that's pretty cool. Do you still do bison now?
No, I haven't had much call for holistic work on bison.
All right, because I know there's a big bison farm out east you can go check out. They got like 200 of them.
We've got some bison farms in Wyoming as well.
I'm sure you do.
Yeah.
But you know, this is New York. What are the chances of seeing a bison here?
Well, we got the wild ones out there as well. So.
Hey, let me ask you this now. When it comes to, say, medication, because again, you started off Western veterinary care. You've made that transition. When you were making that transition, how tough was it to say, okay, you know what? I know certain medications I still, you know, like certain animals to be on because I know they work for them, but making that transition for yourself to kind of start that other kind of thinking, how was that?
It was a gradual process, and it's something that when I took my acupuncture class, one of the teaching assistants said, some of you will go down this holistic pathway and not look back.
Right.
Suddenly I found myself having gone down that pathway and went, oh, how did it get from here to here?
Right.
So I really can't tell you. It was such a gradual process. It was suddenly I was not utilizing the drugs.
Right.
And now that I have a holistic practice, I don't even keep them in stock.
Right.
So if I feel something like that might be beneficial, again, I'll recommend that they talk with their regular veterinarian. Usually they're coming in, they're already seeing a regular veterinarian. They may have them on something.
Right.
Some of them come in because they're going, I don't want to use drugs if at all possible. And we look for what we can do.
Right. Now, is that a matter of, say you keep them, okay, so say the dog is on a specific medication, you're going to keep them on there until you can kind of wean them off? Is that a way to
It depends
go about
upon
it?
what the medication is.
Okay.
And quite often, I don't want to step on the other veterinarian's toes.
Right.
So I may suggest to the owner, if they want to wean it off and we think it's a good idea, that they discuss it with their other veterinarian.
Right.
I do remember I had a dog named George who came in, and George was a chow.
Okay.
At the time, all I did was acupuncture. And he was coming in because he was arthritic in his shoulders and his elbows. And then he started having problems with the hind leg.
Mm-hmm.
And they had taken him down to Colorado for some surgery. He was still having problems. And the owner said, you know, I think this is brain cancer. And her regular veterinarian and myself were going, no, surely George doesn't have that. Well, when he started having seizures, we went, okay, the owner's correct and we were wrong. But her son-in-law was dealing with a brain tumor at the time, so she was much more tuned in to the subtle signs. And at that point, George was on a steroid, and he could not come off of it, or his signs worsened.
Right.
She was also using Amazon herbs, and he needed his acupuncture. In fact, he would let her know. He would ask to go out to the garage and go over to the vehicle, and that meant he wanted to come in and have his acupuncture treatment.
Oh, wow.
Yeah.
All right. Well, good on George for taking the step and saying, hey, let's go. Let's go see Dr. Sarah. Now, when you're working with an animal such as George, okay, so they've been diagnosed with brain cancer. What are some of the things that you can do to kind of help alleviate that?
You can utilize acupuncture, you can utilize herbs, there's homeopathics. There are many cancers that can be reversed. But it does depend. I mean, it's one thing to say we can probably reverse a cancer in a 2-year-old dog.
Right.
If they come in and they're a 15-year-old dog, we're probably not going to reverse things.
Right. Now is that in terms of where that cancer is? Like, say, the brain cancer is probably...
Brain cancers tend to be more difficult.
Right.
Brain and liver sometimes. But the belief in holistic medicine is that the body's designed to heal if given the proper tools, nutrition, whatever.
Right.
But again, the animals do have a shorter lifespan, so there's kind of walking a fine line there.
Right. You got to kind of balance that out.
Yeah.
What about in terms of, say, a lot of dogs get tumors. They get these tumors. I don't know if they're malign or benign or malignant. Which is which, first off?
Benign means it does not spread.
Okay.
Malignant means it does.
Okay. Now, with the benign, is that something that you find that you're able to treat with, say, with the acupuncture?
I have used acupuncture and acupuncture alone in some cases with that for some of those benign tumors.
And what's the whole process? How does that whole thing work? I mean, does it kind of blow away the Western thinking of, well, we usually just go in and remove it, but you're talking about...
Yeah, it kind of does.
Yeah.
I'm even still amazed by it. The approach that I've usually used was one I learned from a Norwegian veterinarian. And he would, again, go in and check the pulses, and he would find what the weak pulse was. And his treatment was designed around that, and he would use just two acupuncture points.
Really?
Yeah.
And that would treat wherever the tumor was.
It would balance things off. He actually has treated people as well, and he had treated a woman with breast cancer and taken some samples of her blood both before and after a treatment, and they found some peptides in her blood that showed up after the acupuncture treatment that were killing the cancer.
Oh, wow.
And he would love to market that, but he's a veterinarian, and the human medical community kind of ignores him, unfortunately.
Yeah, that's too bad, because that could be a big seller.
Yeah, and especially, his thought was you go to some of these third world countries, less developed countries where there's not access to chemo and radiation,
Right.
and there's also not acupuncturists, but this would be a way to go in there and treat people.
Right, yeah. It's kind of amazing when you think about because I guess with stuff like that, the holistic approach, that's the more natural approach. Like you said, the body's going to heal itself. You just got to give it not only the opportunity, but also the nutrition and the environment to kind of let it kind of go to work, right?
Right. And there's a lot that can be done with nutrition. Ty Bollinger's done a lot with The Truth About Cancer, and he did something recently on pet cancer, and Dr. Karen Becker had also done something with pet cancer.
Right.
There's a lot of good information in those areas where we can go in and change and reverse things and prevent things, again, with good nutrition.
Right. Yeah, I think a lot of that is, like you just mentioned, prevention. It's like if you do some of these simple things earlier on, there's less of a chance of a problem later, as the pet gets older.
Yeah.
To fight off these things that might ail them. What are your thoughts on, say, vaccines? Because, when it comes to humans, there's been a whole big debate lately about, you have to get these shots and you're not supposed to break them up, and they used to have more shots, but now they're more condensed, and I'm sure for inside the animal world, it's probably a lot of the same thing, right? That there's differences in terms of, I guess, opinion in terms of which vaccines are needed and which ones aren't?
Yeah, and that's kind of a can of worms. There are what are called core vaccines. So, for example, in the dog, a core vaccine would be distemper and parvo.
Okay.
And those two are always recommended. Some people throw in adenovirus, which causes hepatitis.
Okay.
Other things, parainfluenza, bordetella, Lyme, those are not core vaccines, and they are not needed in every case.
Right.
In the Western medicine, they're going to say we got to start with the core, and we're going to look at what the risk factors are, and we want to vaccinate because we think it protects. From a holistic standpoint, we're going to go with the core vaccines and not recommend anything else in all likelihood. And they will vaccinate farther apart as puppies and with fewer doses. And then we would not give the rabies at the same time as the distemper parvo is given.
Right.
We would spread that out later. And rabies then becomes something that you have to follow your state or local laws on. The distemper parvo, when they've had their puppy shots, a year later you can have what's called an antibody titer, the levels of protection measured in the blood.
Okay.
And if those drop below a certain level, then you would want to boost it. But it's not something that we need to boost every year or even every 3 years.
Right.
We don't do that for ourselves in human medicine. In fact, at one point they're going, tetanus you shouldn't do more than, I think it was at one point 10 years. Because we can see reactions.
Right. Now, is that something you've seen, through the course of your career, where it's like, okay, you know what, we've noticed that animals given this vaccine have developed this or act a certain way? Because with humans, you always hear about that kind of stuff, but you don't really hear about it on the animal side.
It's out there. If you know where to look, and people are doing research, they're coming into me going, I don't want to give all these vaccines. What's your take on vaccines? I start talking about it. Yes, well, they've read the sites from the people that are the main instructors for the holistic veterinarians on what to do, Gene Dodds and Ron Schultz.
Right. And
they'll come into me already having read that, already knowing what they want, which is the method that I will follow.
Right. Now, in terms of your practice, when people come to you guys for the first time and say, they knock on Dr. Sarah's door, they come pulling up with their pet's all happy, like, who the heck is this? Who am I seeing here? It's a brand new person. What's the process like to kind of get them rolling? Especially, say it's a person with a new pet. Hey, we just got this dog or cat. We want to, go this holistic route in terms of vet care. What should they expect when they walk through the door?
Well, first of all, I'm going to find out, have they had a pet before? What is their interest in holistic medicine? What types of problems? What are their questions? And we start there.
Right.
And to find out what it is they already know. Because like I said, many of them have already done a lot of research And it may be good research, and maybe they've found something on the internet that isn't as accurate, and I have to correct that. So it's always an individualized approach, and again, that is what holistic medicine is all about.
Right. And I guess sometimes you run into that problem with, oh, you Googled it. All right, here we go.
Yeah, the Dr. Google.
Oh, Dr. Google. All right, let's dispel this right here, and because you got to make sure that there could be, like you said, there's some good information out there, but you also got to be aware of the misinformation that's out there, right?
Right, and I have to go with my clients. Some of them are more open to making changes, and sometimes I can tell there's certain things that they're not open to or they're not ready to. Right. And you work within their bounds, their beliefs, what they're capable of, whether it's financial restrictions or their beliefs, whatever,
right,
in order to do the best you can to help that animal return to optimal health.
Right. Now what about an animal that may be going into, say, they need surgery? Is that something you can help prepare them for? Because from what I've understood, acupuncturists do help, humans, quote unquote, I get, us, prepare for surgery. And I guess that can have some great effects in terms of not only getting through the surgery a lot smoother, but also in terms of the recovery.
Well, there's things that can be done after surgery with acupuncture, with, if it's orthopedic, with rehabilitation, which is like physical therapy with animals.
Right.
I don't do surgery in my practice, so it's not something that can be done immediately before they undergo anesthesia.
Okay.
Because that's not practical.
Right. Now, how do you feel about that whole process of going under anesthesia for a pet?
There's times when it's necessary.
Right.
I mean, dog's been hit by a car, needs fracture repaired. So there's definitely times when it needs to be done.
Right.
And we do need to look at doing things like spaying and neutering in order to control pet populations.
Mm-hmm. Hey, what's your thought? Because somebody brought this up to me the other day, and I didn't think it was a big deal because I'm like, well, it's going to be winter soon. Why do you need to spray for fleas and ticks? What's your thought on that whole, the flea and tick protection for your basic dogs and cats?
Well, it depends upon where you are in the country. Wyoming, we're fortunate. Fleas exist out there,
right? But
not like in some areas of the country, like Florida. Where it's moist and hot year-round.
Right.
In our area, the fleas are pretty much out on the wild animals. They're on the prairie dogs. They're out in the rabbits. So they're only found really by the ranch dogs that are going out there roaming through those areas. The town dogs don't usually end up with fleas.
Okay.
So I don't really worry about the town dogs needing anything. There are some essential oils that can be utilized as well in animals if they've had problems with the chemicals.
Right.
I have not practiced holistic medicine in areas where the fleas have been rampant.
Okay.
So, but I do know that there's areas where they're a real problem.
Well, I'm just asking because I guess there's that whole flea and tick prevention. Now I guess they have shots too that you can do and be like, oh well, this will work for 3 months or that, and I'm like, do we really want to introduce that to the dog? That doesn't seem right. Yeah,
I mean, you're giving insecticides in a way that's leaked out through their tissue.
Right.
And no, the holistic portion of me goes, ugh, I don't like that idea. But I do, like I said, I do know there's areas where fleas and ticks are a problem. I would certainly recommend someone there first try something more natural, like utilizing essential oils.
Okay. Now, what about spraying someone's property? Because I know people do that too. I get the call every year. Do you want us to spray for fleas and ticks? I'm like, no, it's okay.
I think there's other ways to deal with it. If you've got something on your pet, like the essential oils, it's going to repel them.
Right.
And then if you're just checking them over, there's flea combs that you can utilize as well.
Right.
Putting those chemicals out, they're walking on them, they're licking their fur, they're licking their feet, and they're ingesting it and getting exposed to it in ways beyond what we would do. They're out laying in the grass much more than we are.
Right. Well, speak for yourself. I'm sometimes out there. What? He drags me out. He's like, let's play ball. I'm like, okay, let's roll around. I roll around.
Yeah, but they're out there more than we are.
Okay, maybe. Okay, yeah, a little bit, because they got to poop out there. Hey, but in terms of, say, with like the tick situation, do you ever find that there are certain things that you're like, you know what, I feel good about recommending something like this for that type of issue?
Again, it would be on an individual basis.
Right.
In our area, that we have ticks, but they're not as bad, and we don't have Lyme disease because we don't have the right ticks to carry Lyme disease.
Ah, well, you need to get yourself some ticks. No.
You can keep the Lyme disease out here, thank you.
All right, we'll keep the Lyme disease right here.
Well, I have worked on a dog that had Lyme disease when he lived in Connecticut.
And what are the symptoms? How do you know that your dog has Lyme disease, first off?
Well, he'd been diagnosed when they lived in Connecticut and treated. So once he was out in Wyoming, when he would get vaccinations boosted so he could go board his dog, because so many places require the vaccinations to be current, his dog would often flare up with issues of getting around and arthritic type symptoms.
Oh, okay. See, I would
then treat him. I would then treat him for those issues. Right.
And again, we're talking to Dr. Sarah. She is the owner at 10 Mile Holistic Veterinary Care out of Casper, Wyoming. Go to her website, drsarahholisticvet.com. That's 307-277-4109. That's the phone number you can reach out to this lady, Dr. Sarah. She'll pick up the phone and she'll be like, what do you want? Or she's got somebody that'll do it. When somebody, say somebody rescues a pet, how do you go about helping someone kind of deal with that? Because I know there are certain challenges and issues that come with people that, they're going to step up and be like, I'm going to take this 3-year-old dog that, is locked up in this place. I'm going to rescue him. How do you go about determining, I guess, what their background has been? Because probably people don't know much about, okay, what's this dog's life or cat's life been up until this point, and how do I make sure I treat them properly?
A lot of times you're never going to know what the background was.
Right.
So sometimes it's a matter of psychology and behavior modification and making sure that they learn that they can trust. You can use things like essential oils for helping calm the animals.
Right.
Things can be either put on something on their collar, or you can use diffusers in the room as well.
Okay. So just like humans. They're weird.
My son and I got a dog from a shelter.
Right.
And when we first got him, I think he'd been just chained up outside.
Right.
He didn't really know what to do in the house. He peed on the couch in the living room. He peed on the couch in the basement. He peed on the wall on the stairs to the basement. We couldn't leave him loose in the house because he started destroying things. So I just kept taking him with me in the vehicle. I was lucky it was summer and I didn't have to deal with below 0 temperatures. And gradually, once he felt like he truly had a home, the behaviors went away.
Right.
But you have all different spectrums of that. And you've got some issues with separation anxiety that can be very strong.
Right.
You can also have issues with thunder and noise phobias as well.
Oh, man, I have those myself. Oh, not me. Hey, Dr. Sarah, what about, because you keep mentioning the essential oil, so let's talk about that for a little bit. Because I know, again, all this stuff that we've been talking about, a lot of people are starting to hear about it for the humans. But I know you've been doing this for a while now for animals. And I think it's, as people do, invest in bringing an animal into their home, and again, they become part of the family, you want to really give them the best opportunities to be as healthy and have as long a life as possible. What are some of the better things that you can do? Like, again, an essential oil for fleas and ticks, or something to help keep them calm, or stuff like that.
There's a variety of things that can be found out there. There's one place where I actually get my essential oils is Animalio, Animal EO for essential oils, .info, and it's designed by a veterinarian in Minnesota who's lots and lots of experience with essential oils. She's got blends that are designed for cats, ones for dogs, some for horses. She's worked with livestock. She's got ones geared for the pocket pets, the gerbils and the hamsters and things. So she knows what works on different species and what intensity.
Right.
And so she's kind of my go-to if I'm not sure.
Right.
And that's what I would recommend people check, because she sells both wholesale to veterinarians as well as to to the general public.
Right.
And you can get information there. So if your vet's not utilizing something like that, that's a place where you can go and know you're getting something that's safe and it's been tested on animals.
Right.
And you don't have to guess on your own.
Right, and plus it's natural, right?
It is.
For the most part, yeah. There's no, like, you know, crazy sounding chemicals you have to worry about. It's like, what's this infused with?
No, they're all organic oils that she
right.
gets and uses.
Now, is this stuff that the pet, you can put it in their food, or no? It's more of a topical thing.
It's usually more of a topical thing.
Okay.
Yeah.
Because you know, sometimes, you know, people might misunderstand how to use this stuff. So I'm hoping that if you do take that route and be like, hey, I want to get this essential oil, don't put it in their food. It's not what, hopefully somebody will explain that to you.
That's why I'm suggesting going to this website, so that you're not just going to your local store and buying something and utilizing it.
Right.
You can get some good information from her. She also has a Facebook group where you can post questions as well.
Oh, nice. Okay, so there's a lot of information out there. You just got to make sure you reach out to someone like Dr. Sarah, because she can point you in the right direction. If she doesn't know the answer, of course, she can probably tell you where you can find the answer, which is another great, you know, thing that you can do for people. Again, the website is drsarahholisticvet.com. Holistic, natural. What are some of the other benefits, you know, that people will see as opposed to, you know, the regular medicine care, so to speak?
Well, Western medicine, regular medicine, whatever you want to call it, is more geared to treating symptoms.
Right.
And holistic medicine is looking at returning the animal to the most optimal health we absolutely can. So they're as healthy as possible. You often see more energy, shinier coat, and they usually live longer.
That's always a good thing, especially when there are kids in the house.
Yeah.
Oh, man. It's like, I don't want to be there that day when that happens.
No, the saying goodbye to the pets is a tough thing.
Yeah, I know. Now, what's your feeling on when that starts to happen, when you see that coming down the road, so to speak?
We can have a discussion with each individual owner and find out what their feelings are on it and help kind of guide them to look for when they feel it's going to be time for their pet, because
Right.
it's always an individual decision. And, you know, are they getting up and getting around? Are they still enjoying life?
Right.
Are they still eating? These are all factors that come into play.
Right. Yeah, because a friend of mine recently had a little miniature dachshund kind of thing, you know, or pincher, mini pincher or something like that.
Yeah, there's a miniature pincher, yeah.
17 years, 17 plus years. And, you know, the last few years have been rough. And it was finally, you know, I guess he got put to the point of like, look, I don't want to see my friend suffer anymore. So he had to make that decision. But yeah, it's a tough situation, definitely, when you reach that point, especially when 17 years is a long time, you know, for a dog or a cat, really.
Yeah.
And it's a tough decision for people to make. Now I know you mentioned you've worked with a variety of different animals, you know, the dogs, the cats, the parakeets, you know, stuff like that, the horses. How the heck do you, and I gotta ask, how the heck do you do chiropractic on a horse? Are you riding them at the time and like, wait, let me just pull you this way?
No, you go through and you motion the joints.
But how do they not kick you in the face? I've seen videos where people get kicked in the face. They walk too close to a horse.
Well, you're going to go in and immediately go cranking on them. Okay. You know, you're going to watch the horse move.
Right.
And you're going to know where you're seeing the issues. And with time, you start looking at the animal and kind of getting a sense sometimes of where to start. And it might not be where the main problem is. It might be someplace else that allows them to start trusting you.
Right.
And then you can move to an area where there's more of a problem.
Right.
And again, you're just moving one joint. And so it's not like you're picking up the whole animal. It's not physically that difficult.
Right.
And because I do a lot of other work like craniosacral work, maybe a massage beforehand, then things are easier to move.
So it's almost like you're establishing,
you've
establishing
relaxed the horse,
that rapport.
you've relaxed the soft tissue as well. Because if the muscles rock hard, you're going to have a hard time even adjusting a joint.
Right. Now, when you're doing that, when you're getting, you know, how do you do a massage to a horse? Is it like just doing it to a human? You just kind of hands-on kind of thing?
Yeah, it's hands is stroking. You may use,
Okay.
you can use tools as well.
Oh, you can?
Yeah.
Okay.
You know, it saves on your hand.
Right. And they're all good with that? They're just, you know.
If you get into a spot that's really sore, you back off, you do something else.
Right.
That's why I have so many tools in my toolbox. I can pull out, okay, let's try something else.
Right.
And see if we can do something to relax them and let me get in here. Or you might be able to say, hey, we can only do so much.
Right.
And we're going to have to come back again. And it may take several sessions. Sometimes these things do not fix in one session.
Right. Now, is that something where, you know, before you even do anything, you take the horse out and you walk him and you take a look at his gait and you're doing that whole thing and kind of getting a 360 of how he's moving?
Yes.
Okay.
Yes, you're going to watch him walk away from you, walk towards you, walk around you in a circle each direction.
Do you have
And
him run too?
Not usually,
Not
because
usually?
the walk gait is slower, so you can see more.
Right.
When they're moving faster, you can't watch the body parts and the muscles and the bones and everything as readily because it's just too quick.
Right.
And we do the same things when we're looking at dogs as well.
Oh, yeah?
Yeah, you can evaluate dogs in the same way. Cats, not so much. You may watch it walk across the room if it's going to cooperate.
Yeah, if it's going to cooperate at all. Most of the time, it's just looking at you like, yeah, I don't think so. I'm going this way. If you want to put a needle in me, try and catch me first. Do you ever have that problem where somebody's trying to escape?
Not usually, no.
Okay.
No.
Because, you know, I'm just putting myself in the position of the animal thinking, what's this lady think she's going to do to me? What? I don't think so.
That's why you start slowly and you
Right.
do things in a way that gets them relaxed.
Right. Now is that something where, again, you know, because maybe you've known that pet for a while, and so it's almost like, okay, yeah, this is Dr. Sarah, I'm cool with her, kind of thing, and you've
If
got
they've been in once,
that
they usually
relationship?
want to come back.
Oh, they do?
Oh, yeah.
Do you bribe them with food and treats and stuff?
No, they know that they feel better afterwards.
Oh, okay.
You know. So yeah, the dogs will come in and, you know, just plop down and go, okay, treat me. I was doing a horse a long time ago, and I just was doing acupuncture.
Right.
And the sore back would be better, but it wouldn't really last.
Right.
Then I learned chiropractic. So I treated the horse the first time with chiropractic. There was a spot that was so stuck, I couldn't motion enough to figure out which way to adjust.
Mm-hmm.
So that, okay, even if it's right or left, most of the angle in this area is down anyway. So I just did a straight down adjustment. That horse just bucked up underneath me. I was standing on some styrofoam vinyl covered bales, went flying.
Oh, wow.
There's a hoof imprint in one of the bales. And at that point, the horse was like, I'm done. I'm like, okay, we're done for now.
Wow.
The next time I came back, that time the weather had been bad and we'd been indoors where we didn't have a lot of space.
Right.
The next time the weather was good, we were outside. I would motion, I would see where I wanted to adjust.
Was it that same spot again?
Well, it was multiple spots.
Okay.
And they would lead the horse around. I was standing on my bales. They would stop in front of me, I'd adjust it, and they could let the horse walk off.
Right.
The third time I came out, the horse saw me carrying the bales, came up looking and chewing, going, yes, treat me.
Wow. So he knew good stuff was on the way.
Figured it out.
That's pretty cool.
The dogs usually figure it out faster,
Right.
but that horse what I did was extremely painful for
Right.
it. Because I didn't have a lot of the other tools in my toolbox then that I use now sometimes before I adjust.
Right. Was that something that maybe accumulated over a long period of time, which is why it got so tight?
Yes.
Is that it?
Yes.
And what was that from? Did you ever determine that?
It can be things like poor saddle fit. It can be being asked to do things riding that are over facing the horse or too difficult for it.
Mm-hmm.
It could be a slip and a fall. It could be a rider out of balance. You know, some of these horses that are taking beginner riders all the time,
Right.
they can get pretty sore because the people are still trying to figure out how to sit on them.
Yeah.
You know, or it could be a good rider, but they need an adjustment. Their body's not lined up
Right.
in line. They need chiropractic.
Right. Wow. Okay. Well, that's good to know. Again, we've been talking with our guest. She's the owner at 10 Mile Holistic Veterinary Care out of Casper, Wyoming. Her name is Dr. Sarah. You can go to her website, drsarahholisticvet.com, 307-277-4109, especially if you're in that Casper, Wyoming area. She treats, you treat horses, like you mentioned. You haven't seen any bison. They haven't brought any to you lately, right?
No, I don't think there's too much need for chiropractic in them.
All right. What other kinds of I would say, almost odd pets have you treated? Is anybody walking with a snake and said, here, I got problems?
Not for holistic medicine, no.
Okay.
No, I've actually never treated any snakes.
All right. Fish?
Haven't treated any fish. I don't know a whole lot about fish.
Okay. I figured
I would be like saying, hey, let's see if we can find somebody who knows more.
Right. What about the parakeet? Because you mentioned parakeet. Those are kind of tiny, right?
Yeah.
Like what kind of holistic stuff could
Well,
you do?
I wasn't doing holistic at that time.
Oh,
I was
okay.
asked to take a lump off of it.
Oh, okay.
So
All right.
I was taking a lump off of it and doing surgery on a parakeet, which was a little scary in and of itself.
Gotcha. Yeah, I can imagine. You know what? With all the animals that you treat, I'm waiting for the Dr. Sarah reality show. What do you think? Could you do it? You know, chasing a horse around, trying to get a needle in there? No?
Well, now you're making it so it would look crazy, right?
No, not crazy. I find it
I don't want to go
interesting.
running around after that horse. They bring him, stand there, work on him, and you pop the needles in, and most of the time they don't know.
I understand, but I'm not talking about you talking to animals like the pet whisperer guy. I'm talking like real stuff. You know, where people really bring their problem animals in, and you do your magic.
That's what I do every day.
Right. Because I don't know. I'm just thinking to you that you know what it is, Dr. Sarah. This is where I get all my information on life. TV and movies. If it doesn't happen there, then I guess I haven't seen it. It doesn't exist as far as I'm concerned. So yeah. So when's the show coming out, and where's it going to be, and when can I watch it?
I don't know. You tell me.
It would be a lot of fun, I think, especially because I'm thinking out in Wyoming, you got a lot of space to play, right?
Yeah, we got a lot of wide open space.
So is there a lot of like, you know, do you do a lot of work with like ranchers and farmers and stuff and be like, hey, we've got an issue over here kind of thing? Do you make house calls?
I do house calls.
Okay.
I do barn calls. In fact, my office is not set up to have horses come in, so all my horse work is done out.
See? There you go. You'd be on the road. You'd have the camera crew chasing you around. Yeah. You're doing horses and alpacas, whatever they're called.
There's alpacas and there's llamas.
Are there?
Yeah.
And llamas?
Yeah. They're not the same thing. The alpacas are smaller.
Oh, they are?
Yeah.
Okay. Maybe I can get one for a gift or something. I'm just joking. Again, we thank you so much for joining us. Again, our guest has been from the great state of Wyoming, Casper, Wyoming to be exact, 10 Mile Holistic Veterinary Care owner, Dr. Sarah Daane Froehlich. She's available. Reach out to her, 307-277-4109, or better yet, go to the website, drsarahholisticvet.com. That's doctor, spell out the word. Is it spell out the word or just DR?
It's just DR.
Just DR. DR, short for doctor, Sarah, holisticvet.com. And again, reach out to her by phone at 307-277-4109, especially if you got questions on, you know, the holistic care that she makes available to pets, questions on those essential oils as well, and anything in terms of holistic vet care. Reach out to her. Dr. Sarah, holisticvet.com, 307-277-4109. Thank you again for joining us on All Business Media TV. And yeah, we appreciate it.
It's been fun.
It has been.